Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech. I'm really looking forward to this conversation with Dr. Travis Gayles of Hazel Health. Thanks so much for joining us. To get started, maybe we could do some quick introductions. Name, your role at Hazel.
Sure. Well, thank you for the opportunity to be here with you all. My name is Travis Gayles. I'm the Chief Health Officer for Hazel Health. I'm a pediatrician by training and most recently a health department director in the Washington, D.C. area.
And for those who are unfamiliar, what is Hazel Health?
Hazel Health is a healthcare provider leveraging telehealth technology to provide physical and mental health services to children, primarily through schools. Families can utilize the platform through their school, or they may also be able to use it at home before or after school hours.
And Josh, in his session earlier in the keynote, had talked about how Hazel Health is really transforming healthcare for youth who need it most, which is in the schools. Would love to hear from your perspective why you think that distribution is powerful.
Well, there are a couple of key points. I think the first key point is that it is leveraging new technology to help increase access for children who have otherwise been locked out of the medical system, whether that's from not having access to insurance, and so thereby not being able to access the regular medical enterprise at all, or if they are underinsured. We've done a great job of getting children access to insurance over the last several decades. But now the question becomes is, yes, you have insurance, but what do you actually have access to in a meaningful way? And so Hazel, by using telehealth, has increased, I think, the reach and scope of services that children and families have access to, both in terms of having high quality services on the other end. And then we work also in terms of not only providing that clinical service for that transaction, but our services are set up to make sure that families and children are connected and bridged to those additional support services, whether it's finding a new medical home, reconnecting with their primary care provider, and or also connecting to those resources that help address those social determinants of health that we know can impact a child and family's ability to have a healthy, successful outcome. And so I think combining all of those things, leveraging new technology and taking, I didn't say it and use the word, but the whole child approach in terms of identifying those needs and connecting children and families to those resources is a transformative way of how services are delivered to the pediatric population. And the other thing that I would say that we emphasize, which is going to become increasingly important as we move hopefully into a post-COVID space, is the notion of a true culture of prevention when it comes to pediatric services. Fortunately, children don't get sick often, but a lot of their problems, whether they're physical health issues or mental health issues, are kind of brimming at the top of the pot. And we take the approach of creating that culture of prevention where we're not waiting for their symptoms to be horrible or to be in crisis before we work to identify what they are and work to triage them and get them connected to services to address them again before they manifest in a crisis type situation.
These are all really great points. I'm excited to follow up, but Dr. Gayles, I'm curious, what drew you to Hazel Health?
Well, a large part, a lot of what I just mentioned in terms of being able to be with a company who, one, recognizes the value of technology and taking an innovative set of approaches to addressing long-standing problems. Again, when we talk about disparities in health across the board, access issues, meaningful access to high quality care and resources, those are longstanding issues that we've done a really good job of naming them or renaming them, however you describe them: health equity, health disparities, social determinants, but we haven't done a great job of solving them because they continue to manifest. And COVID highlighted a lot of those longstanding disparities. And particularly, for example, when we talk about mental health access, is we've seen lots of reports recently about the evolving crisis and pandemic, if you will, of mental health issues in children. those of us in the public health world knew that there was a significant crisis beforehand. Children not having access to inpatient and outpatient services, and many folks having to utilize emergency rooms for that, that early care to get their symptoms identified and treated. And so while we're excited that it's receiving a lot of attention now, we also are cautiously optimistic that we'll be able to implement the protocols and resources there to address it. So after my experience as a pediatrician and as a public health official, seeing those problems continue to affect and impact our children, I was excited about the opportunity to be able to come into the private sector and leverage resources there and leverage technology and innovative approaches to be able to address those issues. I'm also excited that there is the realization that it's not just a clinical transaction. So yes, it's important to have high quality care, both from a physical health and mental health perspective, which we do. All of our providers provide great service and are highly trained and skilled to do that. But it really is also about incorporating that whole child approach, where we think through all of those other factors that will influence the child and family's ability to be healthy and successful. And so I'm excited to be a part of the team, and I'm excited to continue to build that culture of prevention so that we can, work to get kids healthy so that they can be their full, authentic selves.
Yes, and what I know about Hazel Health is that health equity is really baked in your DNA. I think it's very exciting. Maybe to talk a little bit more about that, just more broadly, what is working and what isn't working?
Well, I think that one of the fundamental pieces of equity is what do you actually have access to? I think that's the first question. And, when we talk about, again, we've celebrated the fact, which is great, that we've increased access to health insurance for many children across the board. Now, the challenge, though, is that when you do that, the next question is, what do they actually have access to? And that's highly variable depending upon where you live, the state you live, the location, zip code. And we firmly believe that the zip code you live in should not determine what you have access to, both in terms of the scope of services as well as the quality of services. And so we look at, creating the telehealth platform allows us to increase that access to that high quality level of services. And so I think that's a big starting point from the equity pieces. Yes, getting access, and then, what you have access to in that meaningful access way. I think the other component of equity that, again, we're really intentional about is, again, thinking through that social determinants of health lens is, yes, we can offer services that are high quality and you can put those out there, but there's still a whole lot of factors that will influence that child's ability to gain those services. And even when they're locked into those services, being able to be fully present within them and be able to utilize the full spectrum of treatment options that are available. And so we recognize that at least as it currently stands, we aren't meant to take over and be a medical home for a child and a family, but we can serve as an effective bridge and connector for children and families to those services, because we know that when children are engaged in a sustained relationship with a medical provider, we know that they're more likely to have healthier outcomes. And we also know that, even though I'm in the pediatric space, when children are engaged and are having healthy outcomes, that also spreads to the rest of the family. And so if they have a good, meaningful, positive experience and healthcare experience working with us, that also will hopefully encourage the adults in the family as well to seek the care that they need, get their needs addressed, particularly from that social determinants perspective, so that they can also have healthy outcomes as well.
That's interesting. You mentioned family, caregivers, other stakeholders, and In light of just the dire situation around youth mental health, I think that we all have a responsibility to support youth, particularly those that have been marginalized. Do you have any advice for how we can all be part of the solution?
Well, I think representation matters as well. Because representation, increasing the diversity of providers available, increasing the diversity of services available, also allows for opportunities to create spaces where the messaging behind the services provided are translated and communicated in a way that resonates with communities. So it increases their likelihood of uptake within communities to be able to use those resources. I think it's also, and with that engagement, that creates opportunities to talk through, issues around stigma, utilizing services and what that truly means. I think at the same time, it also creates spaces where you can get the larger community engaged and taking ownership and having ownership around developing solutions and strategies to combat these issues. I firmly believe that the clinical encounter is just one piece of how to build systems to help create the systems that are conducive for healthy outcomes. So I think to your question of how does everyone get involved, one, I think it's that immediate engagement in seeing services that folks can trust in and that are grounded within their day-to-day realities that will increase uptake of those services and also increase opportunities for extended engagement to build community systems and community programs that can address all those other facets that we know influences an individual's ability to be healthy.
Can I throw in, where do you see social media playing a role in all of this?
I think social media can be a huge advantage and positive force in helping create this type of change. I know some folks have said that, social media is to blame for, the increase in mental health issues in children. Certainly, it has created a lot of pressure points that children are exposed to more so than when I grew up. Social media was not present when I was a child. Unfortunately, the internet wasn't present either. But as we've matured, certainly, yeah, it can cause pressure points, but I think it can also be an extremely valuable tool to increase, education, increase exposure to what resources are available, and can be an effective messaging tool. I laugh because I think of my nieces and nephew. They are children and younger, and they are proficient in different types of social media. And I can think of TikTok, for example. I'm not proficient in TikTok, but I know that lots of young people watch it and look at it. And so, again, I think it could be an effective tool to message about normalizing conversations around health issues in the pediatric population. But again, in a way that speaks the language of children so they get it and they understand it, as well as, when we think about how to let children know and families know about resources that are available in their communities, I think it can be an effective tool there as well to highlight those resources.
Right. And I just want to stress for the audience, just again, because of the youth mental health situation right now, but especially for youth of color, can you help us understand, what is the impact? What happens when they don't get access to early mental health interventions?
Unfortunately, a lot of the data shows that children of color are more likely to receive some type of behavioral diagnosis that puts them into a Q&A pathway that increases their risk of being labeled as a behavior problem, a misfit, more likely to get a diagnosis of a conduct disorder or a defiant type behavior. And we know, unfortunately, in schools, when kids receive those labels or are put into those pathways, they are less likely to receive the type of resources that can help them and they become our kids who are chronically absent, chronically disciplined. And unfortunately, that leads to a pathway of a lot of other issues as they get older into the juvenile justice system and, the school to prison pipeline, unfortunately, even making that extension. Imagine if when kids are at that early age, when they may have some acting out issues or behavioral issues, imagine if they could actually get screened for depression, anxiety, stress, and as opposed to getting a behavioral diagnosis, and maybe not even diagnosis general, but getting resources to help them cope with what they're saying and cope with their stress and cope with their anxiety. Imagine if we got them connected to those services to address that, how much of those other misdiagnoses or put into those other pathways, imagine how many of them we could steer in a different direction, and be able to help take away those stressors and allow them to be better present in the classroom, and better able to cope and deal with interacting with kids their age. Imagine at how much a difference that could make if we could steer the conversation from behavioral problem to a child who has a health condition and has a need, and get them connected to those resources in a meaningful way.
Excellent. Thank you. Now let's go into the even more challenging aspect of all of this. Can we talk about what barriers must be addressed before we can even get to all of the amazing solutions that we've been talking about? What's standing in the way, and what can we do to remove those, particularly for youth mental health specifically?
We could have a all-day conference, well, multiple day conference on all those barriers, but I want to highlight a couple of key ones. I think one of the first ones is, again, going back to an earlier point, children don't get sick often, and they aren't a huge drain, if you will, on the healthcare system. And so unfortunately, because of that, many of the services that kids need around identification of social determinants and that extensive work and preventive work are not reimbursed and are not supported. And I often tell people, as a pediatrician, there are a couple of things that we talk about. One, children are not little adults, so you can't create solutions. You can't just simply take what works in the adult world and morph it into something for children. They have their own unique and special needs. And they also don't show up to adulthood with a complete blank slate. And so from my perspective, we need to increase the reimbursement and financial support from a payer perspective in terms of covering those services for children, so that, one, they have healthy outcomes, period, but then they also show up to adulthood in a healthier state of physical and mental health well-being. And so I think that's a big one. We've got to figure that out, because even when we talk about, access to mental health treatment, there's high variability in terms of, state by state, in terms of if those services are covered, how they're paid for, how they're reimbursed. And in order to do it really, truly right from that whole child perspective, there's other services that are needed beyond just that you were here for a 30-minute visit or an hour visit for a counseling session. There needs to be support for those, case management and family resource type services that we know are so vital and crucial to addressing all of the issues that can impact that child's ability to be healthy. So I think that's probably the biggest point right now, at least that I see, because when you can create effective financial support and reimbursement, that also increases the incentives for providers to be able to provide those services. It creates, unfortunately, it creates a more attractive field to encourage folks to go into, because we know in the mental health space, there's a huge shortage of providers, at least being able to do in-person therapy in a lot of places. And I would say that is also one of the benefits from the telehealth model, is you can increase the scope of providers and the number of providers who can provide services for a particular area, because you're not in person, and you can, have individuals licensed across multiple states. And that's huge, because that in turn helps address the time to care issue that we know is so significant, So, depending upon where you live, you can get identified as needing services, but it's still a 9 to 12-month wait period. And we've been able, at least in the last year of providing mental health services, have been able to connect kids sometimes in less than a week to services. And usually sometime, within a week to 3 to 4 weeks, which is significantly less than the average that in many jurisdictions that are out there. I think the second component in addition to the payer piece and how that fits together, I think it's the integration of physical health and mental health. I think making sure that, and this is consistent with the U.S. Public Health Task Force recommendation recently in terms of encouraging standardized screening and asking of questions of young people, are they feeling anxiety? In my practice, when I was practicing full-time, I had an adolescent focus. And so my primary population was 13 to 24-year-olds. And for all the college students, I would tell them, don't say you're going to see your pediatrician, say you're going to see your young adult specialist within that. So, tell their college friends. But we always did ask, as part of our standard yearly physical and child visit, are you having any symptoms of anxiety or depression and so forth? That should be normalized across the board. And so as we continue to move forward, creating that culture around where even in physical health spaces, traditional physical health spaces, we're keen to look for any ties between somatic symptoms and mental health symptoms. For example, not all children are great communicators to say, yes, I'm stressed. Yes, I'm anxious. Yes, I'm feeling depressed. But they may come in with that headache that's chronic with no known somatic etiology, or that, abdominal pain that we call NOS, no other source identified within that. And so it's important to be mindful of how those symptoms can manifest in different ways. And so we've got to, be more proactive about asking those types of questions, as well as making those connections across, physical and mental health spaces.
So many good points. I've so many more questions I'd like to ask you too, but I think we have to wrap up pretty soon. So let me see if I can sneak one more in. You talked about payment just now. And I know everything that you're speaking about comes from experience in the work that you're doing at Hazel. So can you talk a little bit about some of your partnerships with schools, Medicaid plans, other payers, other stakeholders to really, orchestrate this highly coordinated care? For those in the audience that are interested in engaging in this kind of work, what foundation do you recommend needs to be prepared before you can bring everything that you talked about to life?
Again, that could be another session in itself, building that foundation. So, one, I would encourage, if folks do have questions about our model, feel free to contact us, and we'd be happy to go into more detail. We've been able to partner with a diverse set of different folks. We've got an extensive relationship with a number of payers who are proactive about doing that and using our partnerships to pilot test different ideas and strategies around, finding what works in terms of how do you incorporate asking for social determinants of health and do that follow up to be able to scale that up across jurisdictions and across state levels. We've also been recognizing that even though we may have a limited scope of services, going back to that notion of being a bridge and connector, is working to create partnerships with health systems who do have those extensive relationships with partners, with payers, to be able to provide those services and increase access to subspecialty care, as well as primary care type medical homes. And so as we also recognize that, and I don't want to seem bashing any part of the healthcare system, a lot of this is new. Telehealth wasn't really heavily supported before COVID, and now it is. And we pushed because we had to be able to offer it to folks, in the COVID space. Now we've got to go back a little bit and build that infrastructure to be able to support it and sustain it. And so, we're excited to continue to move forward and do some of those demonstration pilot type projects to figure out what works and how to scale those things up so that they can be successful solutions in the long term.
Fabulous. Thank you so much, Dr. Gayles. I'm excited for the audience to learn more about Hazel Health and also all of the issues that you highlighted today. So thanks so much for your time and sharing with us.
Thank you for the opportunity and look forward to the ongoing conversation.